Good evening, everyone. I am Dr. Murali Chand from India. Today, I am going to talk about JNA resection. In JNA resection, now with the latest development of endoscopic JNA resection and co-bladder, with this we are using modified Denker's approach, and first we are removing the medial component, medial segment of the JNA. What is medial segment? The tumor which is there in the nasal cavity, that is the medial segment, and the lateral segment is the tumor which is there in the infratemporal fossa. So the first step is modified Denker's and segmentalization. Segmentalization is what Dr. Satish Jain says is, take monopolar section cautery and divide the medial segment from the lateral segment, going anteriorly to posteriorly straight away over the medial pterygoid plate. So that is segmentalization. And then removing the lateral segment by using Santosh Surgical's forceps, crocodile forceps, insulated crocodile forceps, and then applying monopolar. This is how Dr. Satish Jain is advocating. But recently, when we are doing a case here, we had a torrential bleeding when we removed the medial segment. We couldn't understand whether it is median artery bleeding or the sinusoidal bleeding from the JNA. Then I doubted whether this segmentalization doing initially is correct or not. There I got a doubt. Then after a lot of thought process and referring the literature, what I found is Dr. Aldo Storm from Brazil, he recommends midfacial degloving for stage 4 JNAs, which extend into the cavernous sinus and middle cranial fossa tumors. So we are replacing the midfacial degloving with modified Denker's, and first we are targeting the medial segment, that is detaching the medial segment from the lateral segment. This is where I got a doubt. And Dr. Satish Jain sir uses co-bladder for surface to control surface tumor bleeding, to prevent the fogging, to prevent oozing of the blood. Okay, that is for surface and detaching the tumor from subperiosteally in the nasopharynx in the septum area. But he is using monopolar suction cautery for segmentalization and insulated crocodile forceps to cauterize the IMAX artery. Now what I am thinking is whether this segmentalization has to be done first or cauterization of the IMAX for the lateral segment has to be done first after this torrential bleeding case. Now what I am thinking is, let us do midfacial degloving and initially target the lateral segment which is there in the infratemporal fossa, and use the monopolar crocodile insulated crocodile forceps and cut off the IMAX vessels for the lateral segment as an initial step, the first step, and then do the segmentalization of the nasal segment, so that we can prevent the torrential bleeding when we are detaching. So this is my thought process. So finally what I came to conclusion is, always get a neck control for the external carotid, do the midfacial degloving or modified Denkers. First step is to target the IMAX vessels, cut off the IMAX vessels, cauterize the IMAX vessels to the lateral segment which is there in the infratemporal fossa, and then only do the segmentalization with monopolar suction cautery. That day when we had a torrential bleeding, we used coagulator. When I asked Satish Jain sir, what he is saying is, for segmentalization don't use the coagulator, and one must use only monopolar suction cautery. And Dr. Satish Jain advocating coagulator only for surface of the JNA and subperiosteal and subpericardial removal of the tumor from septum and the nasopharynx. So the final thing is, what I am thinking is, in an attempt to remove the tumor through the nose, only through the nose, I think we are removing the medial segment of the nose without cutting the feeding vessels to the lateral segment in the infratemporal fossa. I think that is where we got the torrential bleeding in our case. So step 1, ligation, or at least getting a control over the external carotid. Step 2, midfacial degloving in extensive nasal mass case, or in minimal case do a modified Denkers. And step 2, get a control of the cauterization of the IMAX vessels of the lateral segment. And step 3, segmentalization of the medial segment, nasal segment of the JNA. In such a situation, if we get a torrential bleeding, the only chance is median artery bleeding. That we can stop with muzzle plug from deltoid or whatever it may be, mashed muzzle directly pushing into that median canal, median artery area. That day when we had a torrential bleeding, we stopped with gel foam wrapped in Surgicel. I shared that technique in another video. This I learned from Satish Jain sir only. I kept 2 to 3 at that area and it stopped. So once we cut off the IMAX area to the lateral segment, I think the bleeding will be very less when we are doing segmentalization. And if at all there is a bleeding from the cavernous sinus, we can control with Surgicel and or gel foam wrapped in Surgicel. This is my thought process. Please give your opinion also. Thank you.